Good evening. Welcome to the June 15, 2020 meeting of the Stillwater City Council. We have a full agenda tonight, so we'll go ahead and get started. I will call the meeting to order, and we will jump down to item 2 on the agenda, which is a consent docket, including minutes from our last meeting and approval of the renewal lease with the Multi-Arts Center, which was discussed at our prior meeting. Councilors, comments, questions, or motion on the consent docket?
Mayor, I would like to pull the multi-arts.
Item B from the consent docket will be removed. Further discussion on the remaining item?
Motion to approve consent docket minus item B.
Second.
We have a motion from Councilor Wedlake and a second from Councilor Jaloski to approve the consent docket minus item B. Teresa, can you please call the roll?
Chair Joyce?
Yes.
I'm sorry, Mayor Joyce?
Yes.
Vice Mayor Darlington?
Yes.
Councilor Zanotti?
Yes.
Councilor Wedlake?
Yes.
Councilor Jaloski?
Yes.
With a vote of 5-0, that consent item is approved. We have no one signed up to speak. Is that correct? We will jump down to item 4, items removed from consent. Vice Mayor Darlington, would you like to address item B?
Mayor, I just wanted to make a point for people who are only listening that the name change has been fixed, that from multi-arts to Prairie Arts. And so that's all straightened out from our last meeting.
Thanks for making that point. We appreciate that.
And with that, I would say a motion to approve item B.
Second.
With a motion from Vice Mayor and a second from Councilor Zanotti. Teresa, could you please call the roll?
Mayor Joyce?
Yes.
Vice Mayor Darlington?
Yes.
Councilor Zanotti?
Yes.
Councilor Wedlake?
Yes.
Councilor Jaloski?
Yes.
With a vote of 5-0, that lease agreement is approved. That takes us to item 5, general orders. Item 5A is approve a contract renewal with B&L Heating and Air. Mr. Mark White.
Thank you, Mayor. Mark White, Public Works Director. B&L was awarded the HVAC maintenance contract for the municipal building in June of 2018 in the amount of $50,400. The contract allows for up to 3 one-year renewals and is contingent on funding being approved in the budget. The current contract expires on June 30th, 2020. The renewal would cover fiscal year 2020 through 2021 and begin on July 1st, 2020. B&L has agreed to continue the contract with no price increase for the upcoming fiscal year. B&L has provided reliable and cost-effective service, and staff proposes that we renew this contract.
Thank you, Mark. Councilors, any questions?
Motion to approve renewal of the contract for maintenance of the HVAC system at the municipal building with B&L Heating and Air for fiscal year 2021 in the amount of $50,400. Second.
We have a motion from Councilor Jaloski and a second from Councilor Zanotti. Teresa, could you please call the roll?
Mayor Joyce?
Yes.
Vice Mayor Darlington?
Yes.
Councilor Zanotti?
Yes.
Councilor Wedlake?
Yes.
Councilor Jaloski?
Yes.
With a vote of 5-0, that contract renewal is approved. Mr. White, we also have you for item B here to approve a bid recommendation for refueling services of city vehicles.
Okay. So each year, the city of Stillwater, we purchase approximately 280,000 gallons of fuel. 145,000 gallons is unleaded gasoline, and 135,000 gallons is diesel fuel. We solicited bids to provide refueling services for the city's vehicles and equipment. The specifications listed within the request for bids required that vendors provide at least 4 convenient refueling locations in different geographic areas of Stillwater, along with refueling locations throughout the state of Oklahoma and the surrounding states. 3 bids were received from Mansfield Energy, Pinnacle Petroleum, and OnQ Marketing LLC. OnQ offers the lowest price per gallon and has 11 locations across Stillwater. OnQ offers pump price minus taxes and an additional 1 cent per gallon discount. This 1-year contract would be effective July 1st, 2020, and includes a yearly renewal option for 4 subsequent years. It is our motion to award the fuel bid to OnQ Marketing LLC.
Thank you, Mark. Counselors, any questions?
I do have a question. Mark, it's exciting to know that OnQ would be the low bid, and they have 11 sites across Stillwater. Do they actually have sites in other parts of Oklahoma and outside of Oklahoma?
I'm not sure if OnQ has locations outside, but they're Phillips 66, so we can use our refueling card at the locations that across Oklahoma and then in Kansas, Arkansas, Texas.
Okay, that just wasn't clear in that note. Thank you, Mark.
You're welcome.
Kind of a fun fact that we use 280,000 gallons of fuel every year.
Yeah,
It's a
really.
lot of fuel.
That's amazing.
Yeah. Let's see.
I will
Motion.
make a, oh, go ahead.
No, you go ahead, John.
I'll make the motion to award the refueling services contract to OnQ Marketing LLC for 1-year contract effective July 1st, 2020.
Second.
We have a motion from Councilor Wedlake and a second from Vice Mayor Darlington. Teresa, will you call the roll?
Mayor Joyce,
Yes.
Vice Mayor Darlington,
Yes.
Councilor Zanotti,
Yes.
Councilor Wedlake,
Yes.
Councilor Jaloski.
Yes.
With a vote of 5-0, that contract is approved. Okay, that takes us to 5C, approve a budget amendment reflecting the award of an FAA AIP grant. Mr. Paul Priegel.
Good evening, Mayor, Councilors. Paul Kriegel, Airport Director. And tonight I bring before you 2 budget amendments. This is kind of the final step in our acceptance of the grant from the FAA that brought to you a couple of other times prior to. Back in November of 19, you all approved resolution to go forth and make application to the FAA Airport Improvement Program grant for the second phase of our multi-year apron reconstruction. The total grant amount the total project amount was $6,039,239. And so we went through our procurement application process, and on June 3rd, we received final acceptance of that grant. And so with that, normally we set aside 10% match because these generally come at a 90-10 ratio, 90% federal government, 10% local. And so the second budget amendment is actually because of the CARES Act this year, we're getting our grants from the federal government at 100%. And so we're asking in the first budget amendment to approve the amount of $6,039,239 amendment just to reflect the receipt of that grant. And then the second budget amendment is to move the $655,555 that we had previously set aside for this year's 10% match, move it ahead to a future FAA project, which the next phase will go under design probably by the end of the year with your blessing. That would finish up our apron project with about the same amount. So this 10% would fit perfectly and go towards that amount.
Thank you, Paul. Counselors, any questions? Do we need two separate motions on this item?
There's two in the no, not one to move and one to.
I think there's two
accept.
different budget amendments. I just don't know if they need to be moved separately or if they can just be done together.
You could do it either way. I mean,
Okay.
it's the same project.
Dealer's choice.
Move to approve the budget amendment reflecting the award of the FAA AIP grant of $6,039,239 to reconstruct the south portion of the Stillwater Regional Airport apron, and to approve the budget revision moving the $655,555 allocated matching funds to a future FAA grant project for grant matching.
Second.
We have a motion from Councilor Jaloski and a second from a couple people. I think Councilor Wedlake was the first one in there. Teresa, can you call the roll, please?
Mayor Joyce,
Yes.
Vice Mayor Darlington,
Yes.
Councilor Zanotti,
Yes.
Councilor Wedlake,
Yes.
Councilor Jaloski.
Yes.
With a vote of 5-0, that motion passes. Thank you, Paul.
Thank you.
Item 5D, approve additional funds in the amount of $15,000 for a contract with EST Inc. Mr. Carnes, how are you tonight? You're muted, sir. There you are.
Okay. Good evening, Mayor. We're doing well here. In December of 2019, the council approved a contract with EST to provide inspection and material testing services for the completion of the phase 3 of CY. We established a budget of $53,881.20 for that work. Due to the unusual wet winter we had, it's taken an additional time to complete that project. Those contracts were written on an hourly basis. So we've got those costs already well defined. Same with the testing, took a little more testing. So to complete that project, we need an additional $15,000. Funds are available in the project budget to pay for that. I'm happy to answer any questions.
Councilors?
Motion to approve additional funding in the amount of $15,000 to EST's contract for the identified inspection hours and testing services for the phase 3 completion of the 1735 taxiway and North Apron project at Stillwater Regional Airport.
Second.
We have a motion from Councilor Zanotti and a second from Councilor Wedlake.
I was hoping.
I thought they were freezing you out for some reason.
I did too. Dang.
I was holding my breath also.
I was reading. Sorry.
Just a dramatic pause is all.
Yeah.
We do have a motion and a second. Teresa, can you please call the roll?
Mayor Joyce,
Yes.
Vice Mayor Darlington,
Yes.
Councilor Zanotti,
Yes.
Councilor Wedlake,
Yes.
Councilor Jaloski.
Yes.
With a vote of 5-0, those additional funds are approved. Item 5E is authorize entering into an agreement with Dylan McCarthick to provide resident construction observation services. Mr. Carnes, tell us about this one.
The next two items are directly related to the item that you just approved for the airport South Apron project. The agreement we have with the FAA requires us to provide on-site inspection services. We've done that on previous projects with EST. We've been pleased with that, but we have the opportunity to enter into a separate agreement with Dylan to provide these services. This is not unusual. Past projects have been done by individuals and not necessarily firms. Dylan's well qualified. He's working for a contractor at the moment, and they have done airport work. He's familiar with the procedures, and we have availability here to save a little bit of dollars, and also observe Dylan, that with possibility he may at some time in the future become a city employee providing these services. So we would recommend to you that we enter into an agreement with Dylan for a cost not to exceed $150,000 to provide these services.
Councilor Zach,
Monty, sorry, Will.
go ahead.
So he's working for a contractor now.
He's presently employed by a contractor. He would resign from that job, and then this would be his full-time job.
How does these inspection services work in terms of like liability insurance or anything like that? Is there requirements for?
He has a requirement
have that?
to provide workman's comp insurance. We have not negotiated liability insurance with him on that regard. He's still, he's just observing what's being put in place and making sure those conform to the drawings and specifications. He works in close conjunction with the engineer of record, which is LBR. LBR has had a chance to review the contract agreement and agrees with the language we have in there for that relationship.
So we would be protected in the event that his oversight missed something.
I don't know that we would, if he missed, no, we would not have the ability to go back on him for that kind of work. But I think that's a very low risk. If we want to put a requirement in there for him to have liability insurance, we can certainly look into that. That is right, but we can.
Sure. I was trying to think back to the past projects at the runway where there has been some challenges and complications, and I can't recall where those challenges and complications sat. I just didn't know if this was a time where we needed to be considering that. John, is that, I mean, if in the past, have we always had, I mean, I very much like the idea of being able to work with the resident. And I mean, the concept of it, I just am questioning whether or not we have the protections for such a large project in place.
I haven't seen the agreement, so we normally require liability insurance at least to the state levels, make sure that the city is fully covered. In some instances, we'll require errors and omissions provisions as well. Obviously, workers' compensation is required unless they're a single sole contractor. Whatever the state requires on that, we require. We normally require some level of automobile coverage as well. So until that comes over to us, I can't really speak as to what is in that agreement. So that's something that we obviously would probably want to look at before the contract was executed by the city manager to move forward.
I agree with Amy. I think you're saying it would be a good idea to have this in place beforehand. I hate to think of how litigious our society is, but things happen. And even to protect him and to protect the city.
That's honestly what I worry more about from an individual perspective. I mean, of course, I know we're here to worry about the city, but I worry more about him as an individual, making sure that relationship was contracted in such a way that's protective, I guess.
Mm-hmm.
We can certainly add that requirement to the agreement. John, I'm sorry, I thought we'd forwarded that agreement to you for your review, but we'll make sure that's taken care of in the morning. Amy, back to your question about past projects, the issues we've had out there before were not a result of the inspections. Matter of fact, the inspections are what caught most of those issues.
Yeah, I mean, that's usually the case. I just didn't know. I'm not familiar enough with, I know, that the construction inspectors are out there. I just didn't know like kind of where they are in the process enough to know, like, if he didn't catch something, how would that fall on him? How would that fall on us? Where all that, obviously he's there to catch those things, but certainly we're all human and miss those things too. So
the other changes that have been made administratively is Paul has reassigned an individual to really kind of be an owner's rep on those projects. So we really have kind of a belt and suspenders on that project. In addition, the engineers are out there fairly often making sure it conforms to their design intent.
yeah, it's such big numbers, that we're talking about. I would hate for any one individual to be
Sure.
in a challenging, for some reason, if everything ended up on his shoulders, that would be an awful thing. So.
And we're working very hard, so it's not just on one person.
I think, in light of that, it seems, is there a time constraint with this? Can we get some clarification on the contract before we approve, or?
So the time constraint that we have is the contractor plans to start July the 1st. So we can certainly, do we have another meeting before July 1?
We have a meeting next Monday night. We could put it on that agenda. There are some other action items.
We can move this to July the 22nd.
We'll work real hard this week and get it on for next Monday night.
We don't need a motion or anything on that.
No, sir.
Okay, thanks, Monty. We'll go down to item F then, authorize entering an agreement with the EST to provide material testing services.
That's correct. That would be just an extension of the agreement we already have with them to provide testing services. They've been providing testing services for transportation projects predating when I came on board. We've been pleased with the work they've done. And we're just establishing a budget of $70,000 to do that work. And again, that money's in the budget.
Councilors, any questions?
Motion to enter into an agreement with EST Inc. to provide material testing services for reconstruction and expansion of the south portion of the terminal apron identified as project, oh goodness, AIP 3-40-0090-30-2020, construct south apron at Stillwater Regional Airport and authorize the city manager to sign the agreement. Y'all are killing me.
Second.
We have a motion from Councilor Zanotti, and I think the Vice Mayor jumped in with a second there as well. Teresa, can you call the roll?
Mayor Joyce,
Yes.
Vice Mayor Darlington,
Yes.
Councilor Zanotti,
Yes.
Councilor Wedlake,
Yes.
Councilor Jaloski.
Yes.
With a vote of 5-0, that agreement is approved. Item 5G, approve a budget amendment related to the Western Road and Hall of Fame project. Mr. Carnes.
So about 5.5 years ago, the city entered into an agreement with ODOT to begin reconstruction of Western Road. The first phase of that was to go from Hall of Fame to McElroy. That work was completed, established that ODOT would pay up to $3 million worth of construction. The city was responsible for the design cost and right-of-way and relocation expenses of utilities, and any dollars that went over the $3 million construction. The city put up a deposit, and ODOT has finished auditing that project and shows the balance due from the city to ODOT of $187,104. Again, contractually, we're obligated to do that work, and we're asking a budget amendment of $187,104 from the half-cent sales tax fund to pay for that. The good news is that since we prepared that report, we've got word from them that the next phase from McElroy to Lakeview actually results in a credit back to the city of about $73,400. So the total hit budget is only $113,704. But we still need the budget amendment in the amount stated to take care of the accounting. Happy to answer questions.
Councilors, questions?
Monty, is that a normal amount of time for a project to take from 2014 to now?
Well, it's tied more to when they finish construction and then how long it takes them to settle with the contractor after the construction, and then for them to go through their audit process. We still haven't had the audit at 6th and Perkins, and we've been completed with that for almost 2 years now.
Wow.
Is that an internal audit that ODOT does themselves, or is there some like outside person that does it? Do we get to participate and make sure we agree?
They do the internal audit, and then we review the audit. They actually submitted this back in December, and we had some questions about it. And at one time, we thought we were getting double charged for some stuff. But Cindy Gibson spent quite a bit of time going back through the records. And then I went through and determined we were not being double charged. And then I went through the audit to verify the expenses were reasonable and seemed to me to be legit. And we both convinced ourselves that it is the correct amount of money.
Complicated.
Is there a motion?
Let's see. Approved budget amendment for the amount payment of $187,104 from the half-cent transportation sales tax fund to Oklahoma Department of Transportation to close out phase 1 of project Stillwater PW05 widening of Western Road from Hall of Fame to McElroy.
Second.
A motion from the Vice Mayor and a second from Councilor Wedlake. Teresa, could you call the roll, please?
Mayor Joyce,
Yes.
Vice Mayor Darlington,
Yes.
Councilor Zanotti,
Yes.
Councilor Wedlake,
Yes.
Councilor Jaloski.
Yes.
With a vote of 5-0, that budget amendment is approved. Thank you, Monty.
Thank you.
All right, that takes us to item 5H, which is a budget amendment reflecting donations to the Stillwater Public Library. I think Stacy's not here with us tonight, and I know Norman told me somebody else was covering it. Oh, there she is. Hi, Melissa. I was looking for your name.
Good evening, Mayor and Councilors. Melissa Reams, Deputy City Manager and Chief Financial Officer, representing the library this evening. This is our monthly budget amendment to put into the expenditure stream donations that have come in throughout the month. This month, the budget amendment is for a total of $397. $30 is in undesignated donations. $287 is designated for book purchases, and an $80 donation reimbursement from the Children's Friends of the Library, or for the Children's Friends of the Library project. And so we are here this evening asking for your approval on that budget amendment.
Thank you, Melissa. Councilors?
Just want to thank
No, go ahead.
thank Stacy Delano for the work that she is always doing, gathering grants and donations, and I'm happy to have the library accessible again.
Absolutely.
Good.
Motion to approve budget amendments reflecting the following donations to Stillwater Public Library: $30 in undesignated donations, $287 for designated book purchases, and $80 donation reimbursement from the Children's Friends of the Library Project.
Second.
We have a motion from Councilor Wedlake and a second from Vice Mayor Darlington. Teresa, can you please call the roll?
Mayor Joyce,
Yes.
Vice Mayor Darlington,
Yes.
Councilor Zanotti,
Yes.
Councilor Wedlake,
Yes.
Councilor Jaloski.
Yes.
With a vote of 5-0, those budget amendments are approved. Item 5I, approve budget amendments to increase the health insurance claims budget by $275,100. Christy Clark.
Good evening,
And
Council
Christy
and Mayor. Yes. The city provides a self-funded group medical plan for its employees. And in recent years, the city has seen an upward trend in its health insurance costs. And we do anticipate that the actual health insurance claims expense for FY20 will exceed the budget for that line item by about $400,000. $125,000 of that budget shortage can simply be covered through a reallocation of available budget and other line items in the self-insurance fund. To cover that remaining $275,000, staff is proposing that we use proceeds that we have received under our medical claims reinsurance policy to cover that. So the recommendation before council this evening is to approve a budget amendment to increase the health insurance claims budget by $275,100 with an offset to reinsurance reimbursement revenue in that same amount. And I'm happy to try to answer any questions you might have, or Christy Looper, our HR director, is also joining us in case your question is more suited to her.
And thank you both for being here. Councilors, any questions?
Just out of curiosity, what do you foresee as the big driver behind this need for an increase in funding for insurance claims? I mean, is this COVID related? What's the thinking here?
I'll take that one.
Sorry to bring up COVID early, but we're going to get to it at some point. So
right now, we don't believe it's COVID. We were seeing this trend early on in the first even 6 months of the plan. We have had several illnesses and accidents that were unplanned and unforeseen that have hit our plan this year in some pretty high numbers, with a larger than expected spread across a number of applicants or covered lives. And so it can be attributed to multiple different individuals' illnesses and accidents. Happy to answer any other questions.
So sorry, I was muted. So an increase both in the number of claims, but also in the I guess price per claim. The claims that we're seeing are just more involved claims.
Correct. We saw a number of large claims. We track for our reinsurance to receive the reimbursement that Christy is referencing. We track them at 50% of our $130,000 cap, 75%, and then when they hit, we've had a number of individuals on our 50% watch list throughout the year. So we like to hover at smaller numbers for those because obviously it's less of a health impact to our employees and a financial impact to ours. And it's just been from the beginning of the plan year a larger number of high dollar claims for certain individuals.
Thank you, Christy.
Thank you.
Any other questions, councilors? Is there a motion?
Motion to approve budget amendment to increase the health insurance claims budget by $275,100 with an offset to reinsurance reimbursement revenue.
Second.
We have a motion from Councilor Wedlake and a second from Councilor Zanotti. Was there further discussion? I heard somebody start to talk there. All right, Teresa, will you call the roll?
Mayor Joyce,
Yes.
Vice Mayor Darlington,
Yes.
Councilor Zanotti,
Yes.
Councilor Wedlake,
Yes.
Councilor Jaloski.
Yes.
All right, with a vote of 5-0, that budget amendment is approved. Okay, that takes us to item 5J, the discussion that you've all been waiting for. This will be our COVID-19 update and the current status of the COVID-19 pandemic in Stillwater. Unfortunately, after a couple of meetings without a whole lot to discuss on this front, we certainly have quite a bit to discuss tonight. I'm sure everyone on this call is aware, or at least on the Zoom meeting is aware of the increase in numbers we've seen over the last week and a half or so, really since the 2nd of June. Our numbers have gone up substantially after having about 22 cases for the whole time, March, April, and May. I think today our total was up to 78 total cases, with about 50 or so, 59, I think, of those being active and new in the city. That's certainly concerning and somewhat problematic. We've been, I've had a couple of discussions with the health department, with the folks from the hospital here last week and again today to discuss kind of what we're seeing in those numbers, what issues they might show, what actions we might need to take or could take to help deal with them. And I think the main part of the information that we've received so far about those numbers is that the majority of them, the large majority of them, is in young adults age 20 to 26 or so, 27, and that there seems to be a high degree of relation between the cases in terms of folks that knew each other, were together, were in similar places, that sort of thing. Now, not all of them together at the same time at one place, but in similar places, you know, these two are connected and that one's connected to this one, and there's a lot of similarity in similar, I think, activity in a lot of those cases here in our community. We do know that a number of those are from athletes that have recently returned to Oklahoma State, and again, in a similar young adult population. None of those folks are currently hospitalized. I think from the hospital's perspective, they're not currently treating an inpatient. That was as of earlier this morning, inpatient cases at Stillwater Hospital, which is certainly good news. And again, given the sort of age range, that they would certainly, these cases would fall within the sort of at least lower risk categories of folks. So in discussing that with hospital and with the public health, the county health department is not making any particular recommendations in terms of closing things or moving backwards in our phased opening plan. We did discuss with staff today. I discussed with staff today potentially what going back to phase 2 might look like in terms of an emergency order that would take us back to limitations on the number of people in a given restaurant or bar or those kinds of facilities, churches as well, those kinds of things. I think that's a possible response to this. I've been personally going back and forth all day about what the best response is to this at this point, and whether a response is necessary at today, given where we are. And I guess I will just sort of talk through why that might not be necessary and why it might be, and then you all can certainly add your thoughts. Given the age range and the way that these cases are presented, we're not looking right now at a particular threat in the healthcare system locally. There has been substantial increase in testing in Stillwater, especially given these cases, right? So with just as an example, athletes returning to the university, all of those folks and the staff there have all been tested in the last couple of weeks. Those were all new tests of asymptomatic people at the time, and then given that there have been positive cases in some workplaces around town, there have been a number of other folks that have come out to get tests. I think the hospital estimated earlier on Friday that there were probably 200 pending tests in Stillwater, which is a significantly higher number than at any point previously in the pandemic. So there is a lot more testing going on, a lot more testing of asymptomatic folks that probably wouldn't have known that they had COVID if someone, they hadn't been alerted by the county that they were in contact with a positive. So given that, it's not really a surprise that we're seeing an increase in positives. Now, whether that increase in positives is proportional to the increase in testing is another story. And unfortunately, we don't get good data on local positive percentages. The state's local positive percentage has been higher the last couple of weeks than it was previously, as far as I can tell, although the state only publishes a cumulative number. It does not publish a week-to-week or day-to-day number. But there are people on Twitter that do the math and try to figure out exactly how many people were new this week and last week, and I will just add that that's unfortunately part of the place that we get information about what's going on, because we don't get day-to-day numbers on public, on test positives, percentage of positives. We don't get specific data on most of this stuff. And thankfully, there are either news organizations or people out there who are trying to do this math themselves. I've got my own spreadsheets that I've built to try to keep track of it, because we just don't get good, clean, day-to-day data released to us. And that is really difficult when it comes to decision making on both sides of things, right? I mean, if we had better data, we might be able to clearly make easier or at least somewhat easier decisions on what to do. So more testing, more people in town, lots of leases started the 1st of June. I definitely saw lots of folks moving in. So there is reason to expect that we would have seen an increase. We were also very low prior to this in terms of per capita numbers in Stillwater, mainly because a big chunk of our normal population wasn't here for a couple, 3 months, really. And so all of those things would point to the idea that it's certainly not expected to see a rise in cases at this point, given people are back, things are open, that stuff's happening. Given that this is so far not affecting the healthcare system significantly, that I think would mitigate towards saying, maybe it's not time to take too drastic of a measure, other than being vocal and vigilant about trying to get people to practice social distancing better. That was the message from Ellie at the Public Health Department to me this afternoon, that their recommendations are continue to be maintain 6 feet of distance from other people. If you are not able to maintain 6 feet of distance, you should absolutely be wearing a mask in any setting where you're not able to maintain social distancing. Practicing all the good hygiene around covering, coughs and washing your hands frequently, avoiding crowded areas, in areas where you're going to be up, close to people for, more than 5 or 10 minutes at a time. Those are the high risk situations, and those are going to be your bars, your social gatherings where you're out, close to people for an extended period of time. Churches, if you're not distancing from people while you're in church, sitting next to them, for an hour in the morning is a high risk environment. And so their conversation was around, doing better and making sure people understand that those are still the CDC and state recommendations. So all that being said, I'm not sure that it's time to step back. The other concern I have with stepping back is that how long do we do it? Do we do it for a week or two and sort of see if the numbers level off? And then at that point, we open back up. And then, if people are not, still not practicing those social distancing guidelines, are we going to see another spike just like this? And we're going to have to push back again, and we're going to end up in this sort of back and forth yo-yo where nobody knows what's expected on a week-to-week basis, and we're really not improving the situation. Those are my thoughts today, and all that. Of course, the other side of that is we've got more than double the number of cases in Stillwater just in the last 2 weeks than we had in 3 months, and clearly we're not following social distancing guidelines, and clearly we're not doing a good enough job of keeping this thing in check. And so that would suggest that we, as a city, need to be more demonstrative and require those things to happen by limiting the number of people who can be in restaurants, that sort of thing. So I would love to hear your thoughts. Love to hear, what you all think about the situation and which way you think we should move.
Well, I'm sure I'm not alone. I think I spent a lot of time on my phone this weekend answering emails and texts from individuals who were concerned about the increase and what the protocol was and what does it mean when a business has a positive case and what happens. But two things come to my mind. The first one is I think we have an awesome opportunity, and Mayor, I know that you've had interaction with officials at OSU, but in my mind, this is a wonderful opportunity for the city and Oklahoma State University to collaborate, to think about messaging, especially for that particular age group that's moving back into our community, that, maybe Oklahoma State has a better way of messaging or getting things to that student population than the city would, just because that's what their focus is. So working on some messaging about the importance of wearing a mask and, trying to make it, I don't know, it's never going to be the cool thing, but just the importance and the messaging of you're coming back into a community that has really done well with flattening the curve. And we want to continue that, and their help and support in doing that means this and this. And so that's part of it. And then the other part, I think, is I did answer texts and emails and was hopefully respectfully blunt to friends and family and people I didn't know. This is a community-wide situation in the fact that it can't be just the city council, and it just can't be Oklahoma State University. It needs to be everybody standing up and protecting themselves and others. So if you see people that that aren't wearing a mask, encourage them to do so. I think each of us need to take responsibility for this and not depend on just a select few to do that. We all care about this community and want everyone to be safe and healthy. And so I think it's all of our responsibilities to do that and not just a select few. So those are my two thoughts.
Thank you.
Elaine, I like that your statement about everyone taking responsibility for reminding people to have masks on. I won't give you the details, but I do ask people, and they look at me like I have like 9 heads, and I will not spend money in this establishment if you do not wear masks or require masks. I think the businesses also, how can this be an economic help to open up if you have to close? I don't get it. I think our message about masks should be not as halfway, wear a face covering if you can't maintain 6 foot of distance. You should just, when you go outside your door, you should wear a mask. You never know when you can or can't be 6 feet away. So just wear a mask. Now, I think OSU is requiring masks on campus. Is that correct?
They are. I don't think they're requiring masks. I think they are handing out masks. Their plan is to give everybody a mask and to strongly encourage it. I think there are certain settings where it will be required, but I think they will just strongly encourage mask wearing.
Okay, I heard that it was a requirement, but
that could change. I'm not the.
If they could do that, wow! If they can do that, I also totally agree, and this is what I asked for several weeks ago, that our marketing people get with OSU and create some type of a messaging that would be toward the students. This is not a surprise. We predicted, Will, you've been talking about looking toward the fall. Well, this isn't the fall. It's a little bit sooner than we thought, but we knew when the students came back, this would be a problem. And I don't understand why we have not been on top of getting that message out to people that we know have not taken this seriously. And I also feel a little bit frustrated with this kind of dismissive attitude that, well, these are young people. They're not that sick. They're not in the hospital. They're the people working in every place that we go to, and they have families here. So, if you don't want to do anything now and you want to wait 2 weeks to see who the next level of people are who are affected by these 72 or 58 or whatever, then, maybe that would be our test for what we want to do as far as closing or putting stricter limits on gatherings. But this is the exact, yep, they're young, they're not that sick now, they're not that sick yet. But there's a whole bunch of us that are going to be stuck in our homes again.
Yeah.
So,
the question for me is, there's going to be students that, or people, it's not just students, it's people of any age group that are positive for this disease for the foreseeable future. And the question, I think, for us is, at what point does that require action on the city's part? I don't know that we're ever going to get, we're at this level, and if we don't get down back below this level, maybe it won't grow as quickly at some point in the future if people are actually practicing social distance they need to. But when do we, what's a level that is sustainable, with somewhat normal operation, and what's not sustainable? I think that's the concern, or the question is that I have, is that if we roll back now, and that either, and it helps, do we open back up, or do we just leave it, we go, okay, well, this is working, so we're just going to leave it at this level forever, or until, there's a vaccine or whatever it is. And that I think is not, I'm not sure that's sustainable. I know kind of the going back and forth kind of thing isn't going to be sustainable if we're, having to try to make that decision with, again, really poor data. I didn't mention this before, but the fact that we don't know sometimes with these addresses that students report for sure that if there's how many positives there actually are here, it just becomes a really difficult decision-making process every time when you're trying to go back and forth. And so, my concern from the beginning, and I think the city's, our concern generally from the beginning has been healthcare capacity and healthcare response. We're not going to be able to keep people from getting sick. People are going to get this disease. Our responsibility is healthcare capacity and maintaining our healthcare system's ability to treat not just COVID patients, but everybody else who gets sick here on a regular basis. And so if that's the major concern, then I would think that would be part of the trigger on, when do we start to really concern ourselves with it? If we've got 50 sick people in Stillwater, but none of them are in the hospital, do we really need to put more restrictions in place?
Well, I think those comments kind of drove home what my comments were going to be, in that, we need some kind of barometer here on, at what point do we decide to take action again as the city? And the whole idea of flattening the curve, yes, is to maintain our healthcare infrastructure and make sure that those services are not overwhelmed, so that we can continue healthcare services to like you said, not only COVID patients, but anybody that needs to be admitted to the hospital. So I think that's a good barometer to use. The difficulty about that comes about because, you may see no patients in the hospital now. You may see no patients in the hospital tomorrow. You may see 1 on Wednesday, 4 on Thursday, 16 on, it's that exponential spread is the difficult thing about this. And you're right, Mary, your comments are taken in good context, because it's, at what point do you make that decision to start, limiting people's activity and saying that we're going to decrease the amount of group sizes and the way that you move about the city. I honestly, I don't know that there's a good answer for that. I think that the best or the most, common sense answer would be to monitor the burden on our healthcare infrastructure right now. And you're right. I don't believe that there's a single person in the hospital with a COVID-related disease right now, and despite the number of positive cases that we've seen uptick in the last several days. So, trying to find that barometer or where that point is of when we, as the city, step back in and say, we're going to have to tighten the thing back down and batten the hatches, so to speak. I think that looking at our hospital numbers is probably as good as anything that we have right now, even though that may not be a great way to do it, but it's the best that we've got. And so, I think that's something that we need to follow very closely and have a very low threshold to step back in if we start seeing numbers in the hospital go up. Because people being infected with COVID, especially asymptomatic people, that's one thing. But when we start seeing significantly ill people or people that are requiring mechanical ventilation or life support services, those beds get used up very quickly. And so my 2 cents would be that I think that that's an adequate barometer to look at, but I would have an exceedingly low threshold to step back in as the city.
Yeah, and in speaking with the health department today, and them saying they're not recommending particular actions at this point, but that could change pretty quickly depending on what the numbers look like and what the demographics of those numbers look like in tomorrow or the day after. And I think that's I say all that, and then I say, isn't it just inevitable that we're going to see cases in the hospital within the next couple of days? And why would we wait for that if we feel like it's inevitable? But I can't predict this thing.
Mm-hmm.
And I just, nobody is giving us clear indications of what these, steps should look like. And so we've got to make them up on the fly. And, the hospitalization rate does, to me seems like or at least a higher incidence in at-risk populations that would tend to bring hospitalizations would be a different consideration, I think.
I think we're at this point where we're having to look at these strategies with a much finer toothed comb, right? We don't, all the big thinkers and around the country are telling us that it's going to be really challenging to just shut everything back down again, and our economy won't do it, our people won't do it, our communities won't do it. How do you, then if that's the case, if we don't have that broad brush to apply any longer, then it really is back to kind of what Elaine said in terms of our own personal responsibility. And it's back to what we can do as a community to educate our community. And then, I don't know, for me, though, I've been trying to do a lot of reading the past few days, and this idea of kind of harm reduction has kind of been a big topic that a lot of people are talking about. We can't prevent every illness, but how do we mitigate it so that the harm of those illnesses is minimized as possible? And so, does that mean going back with a finer tooth comb and saying, gatherings seem to be where the data is coming from right now, and so gatherings, we're going to limit, gatherings? Does it mean we step up our education? You're realizing, like, with everything we do on Facebook, you're realizing, like, the people that need to see this right now are not on Facebook. Like, how do we reach those people? They're too cool for Facebook, right? So, I think we definitely need to be more strategic in the way that we get this information out, and then just more I don't know. I don't get it. I'm feeling frustrated that, people, they want to protect the restaurants, and we want to keep all these businesses open, and they're all the businesses that we love, and they're all the restaurants that we love, and they're all the people that we love too, but they don't want to do the work of protecting our community. And I'm frustrated by that. If you love your hairdresser and you want her business to stay open and you want her to stay well, then wear a mask. It's frustrating that people won't take that do that one small thing for somebody that they, go see every month. And, it's just hard for me to understand why people won't make that small sacrifice for the good of our community long term, for that ability to move into a fall without some of these challenges and complications. I'm personally feeling really frustrated with that. I would love to come up with a way for us to put that frustration into some sort of action, whether it's educating our community or laying out these thresholds that tell our community, if we get to this level of hospitalization, like these are the things. Maybe that's something, it's a goal for us to strive to stay below, or something for us to work together towards a common good. I don't know how we frame it to bring more people into that fold, but I don't know. And then I do think the other thing with some of the education, just in those preventative and harm reduction strategies, I do think I know a lot of the questions that I've had and have been around, I ate at that restaurant and they had an employee, they've posted on Facebook that they're closing, what do I need to do? I think this kind of piggybacks on our last conversation that we had with Kelly at the Radar at the health department, in terms of what does contact tracing look like? And, if you ate at a restaurant, are you going to be, will you receive a call, or do you have to have a certain amount of exposure, kind of what their thresholds are for those types of things, I think would be really helpful. So, because I know we picked up some carryout from one of the restaurants that has reported a case. And I know I was kind of like, whoa, what does that mean for us? Am I going to get a call, or am I not going to get a call? And so understanding that, maybe it's, if you weren't within, proximity of that person for, I don't know what their threshold, maybe 10 minutes or 15 minutes, I'm not sure. But I think that might go a long way, for the people that are just really concerned about being out and about in the community right now. Understanding that process could be potentially helpful. Understanding, I've had a lot of people say, like, why aren't you publishing a list of these businesses? I don't really know I don't think that that's our place, but understanding, how they might go about getting information if they're concerned and things like that, I think is something else that we can work on with our local partners, whether it be the health department or OSU. Those are kind of just some of my thoughts.
Yeah, I completely agree on some of that, the specific information that you're talking about that needs to be out there better. And we did talk about it, some of that with Kelly a couple weeks ago. I asked her a few of those questions today, and there were a couple of things that came up. I know that someone has published a list of places, restaurants that have that they say have a positive case. I will state unequivocally here that did not come from the city, and that did not come from the county health department. Those are, we don't receive any of that information directly. The county health department doesn't, certainly doesn't release it in that way. If they, if they had a test and that person tells their employer, and if there's an issue that the county health department needs to follow up with in their tracing, they will. But they haven't forced or told any businesses that they have to close. They don't have a blanket rule that if you have an employee test positive, you have to close for 14 days. None of that is the case. They are doing contact tracing on every positive case, including ones that don't necessarily, people, if it's a student and they've listed an address somewhere else, well, that number might not show up in our city number, but if they're tested at Payne County Health, or Payne County Health knows about that test, which they will through the contact tracing, then they conduct the same tracing on that person that they would on a local case. So those lists aren't, there's a number of places that have said, hey, we had a case of COVID-19, so we're closing for a couple days to clean or whatever it is, but that's their decision. And if they announce it, that's up to them. They don't have to announce that. They don't, there's no list. There's no official list of those things. And like you said, with contact tracing, the only time the public health department's going to get involved is if they identify someone as a close contact, right? Just having been to a restaurant where, a person tested positive does not make you a close contact. I think it is, within 6 feet for 10 minutes, something along those lines, that is where they start to identify risk. And they will call you and tell you, hey, you have been identified as someone who was in contact with a COVID-19 patient. So we do need to communicate that more clearly, for sure. I think we need to communicate the necessity. If you have been contacted by the public, they do a great job of keeping up with people. I think they actually call them, or there's like a machine that calls them like every day and reminds them if you're supposed to be in quarantine. So if you've been in contact with someone and the health department has contacted you, they make you stay in quarantine for 14 days, even if you test negative. So because it can take a while for those tests to work, they don't even care if you test negative. If you were identified as a close contact and you're asked to quarantine by the health department, you have to quarantine for 14 days, no matter what. Same with a positive test. Even if you test negative, a couple days later, you're still in quarantine for 14 days, or isolation for 14 days if you're positive. So, they're keeping up with that.
Mayor, can you also speak, or I can too? Just I had a lot of questions and a lot of answers as far as them wanting to know the specific person, and that's not the point, and it's not names are not being given out. It is a privacy issue, and so really the focus more is on ensuring that if the Payne County Health Department is doing what it needs to do in order to follow up if there needs to be contact tracing in that. And I think it's one of those things where we did have Kelly a couple of weeks ago, but it's kind of like a lot of things, until it hits or until it happens, it's hard to remember everything. And then suddenly when it does, there's a sense of panic, or a sense of, well, I don't remember if they said this or they didn't say this. So, I don't want to reiterate again what you said. I think the more information we can get out, this scenario happens, this is what, and I don't know if the health department already has something on their website that explains that the city can share out, or if we need to do a sheet of our own. I don't know, but I do think the more education and the more information of the protocol of what happens will help diminish, hopefully, some of this panic feeling that people are expressing when they hear of a case.
Well, I hope it also encourages people to comply. I think, the more education that we have out there to begin with, hopefully it kind of takes away some of the scariness of what that phone call would entail and how you would comply with that phone call, and what they can do to help you comply with those quarantine, if you are asked to quarantine. Kelly had mentioned, they can provide notice to your place of employment. They can, potentially help you find a place to quarantine if you're not able to. I think the more that people understand, this is the way it is right now, without a treatment, without a vaccine, this is our only opportunity to fight back this disease in our community. And so understanding what that looks like if you were to get a call, I think is just really, it just takes away some of it's just a little scary and unknown. And we don't have these, we're not telling everybody they have to stay in their houses anymore. So there's just that level of fear, I think, that comes with all of those things that we don't know about.
Other information that needs to be communicated is, I had 2 frantic calls this weekend. I'm sick. I've been to the emergency room and they said I can't go there. They don't have tests. You need to get sick in the daytime when other places are open. The hospital is sending people to AMC or to your primary care physician. And so you, during the week, of course, you can go to the county health department, and that is free testing there. It's there's a cost associated with testing other places, but people don't know where to go. And when the hospital emergency room cannot accommodate them, they really freak out. And so clear information about where in Stillwater do you go and what are the hours. But don't decide at 11 o'clock on Friday night that you're sick.
Well, I just want to be clear. I mean, what the hospital would be doing is if you don't require hospital treatment, they don't want you to come to the emergency room. Is that correct? I mean, they're not providing an emergency COVID test just because you have a fever, right? If you don't need to be hospitalized, they're not going to admit you and give you a test.
The emergency room?
Yeah.
Well, whatever the reason, when people are sick and they don't have a primary care physician, where it is the first place you think you should go? The emergency room. And so then you go and they say no, and you're like freaking out.
We need to get clarification on that for sure.
Yes, and it needs to be printed and published and disseminated to this large population of new people in town.
Yep. That's a really good point and a good question. It is, the county health department is free. You just have to call. You don't have to have symptoms. You don't have to have a doctor's note. It's 372-8200. You call them up. You give them your name and address. They schedule you an appointment. But again, you're right. That's not at 11 o'clock on Friday night. So there are a number of other places, AMC and urgent care, that are potentially doing tests as well. But I think it is necessary for us to put together a comprehensive list of what testing options and when and where and all that kind of thing. I think you're right.
Might be nice. Maybe the hospital could do that.
That would be nice.
John, you mentioned having a really clear threshold. I've forgotten the exact words you used. What would be your suggestion?
Well, my words were to have a very low threshold while monitoring the inpatient numbers at the hospital. Now, what that number is, I have no idea. I mean, when we look at demographic data and epidemiological data on this disease, we're looking at a mortality rate of between 2% and 3%. At least that's the data we have from the coast here in America. The data here in the Midwest is not quite as robust because we've been spared largely up to this point, just by the geography of our country. So with a mortality rate of 2 to 3%, Stillwater now has 79 cases total. With the math working out, we could expect about 1.5 to 2 people have died from this disease right now, just based on those numbers. Again, we're talking probabilities here. We're not talking exact numbers. So that's what makes it even more difficult to say a hard number. If we have 2 patients in the hospital with COVID, that's where we start stepping in as municipal authorities and reenacting some measures that we've enacted in the past. But again, I don't know. I don't think that you can put a hard number on that. In fact,
John,
I don't. Yeah.
Can it be about the number of hospital beds? I mean, if we don't have a lot of hospital beds, I mean, is there if you have 2 or 3 and you're using up, I mean, we don't have very many hospital beds to utilize, would that give us a better idea of what number to go with? Because you only have so many hospital beds available.
Yeah, I mean, so we have 7 ICU beds at Stillwater Medical Center, but we have the capacity for, I think at last count, we have capacity for 13 patients on ventilators. Don't quote me on those numbers because those numbers may not be even still correct. But 7 ICU beds with roughly 13 beds with the capability of managing somebody who is critically ill. So again, I mean,
Would it make sense to work with the hospital, because the hospital is the one seeing if they suddenly are concerned that there's a increase in number of people they are seeing,
mm-hmm. I mean, if you
It's
look
hard
at
for
it,
us to get.
if you look at it strictly from a mathematical standpoint, then I would say that you need at least 2 days of data to see what the predicted exponential increase in hospital beds would be. I mean, that's just the pure hard math of it. I don't know that that's the right answer either, but you would need 2 days at least to see a trend in increase in critically ill patients. And then you could make a terrible prediction on what that may look like in the 3rd, 4th, and 5th day.
These are all terrible predictions at this point, John.
Well, that is a statement of fact, Mr. Mayor. So go ahead.
I am really frustrated that we have to sit here and guess about this stuff when the hospital is not involved with us.
They are. I mean, we're not here. We're just, we're talking about what the city's response needs to be at this point. But the hospital is having these discussions. They're monitoring. They're concerned, but they're also not. And I have no doubt that if they have inpatients and they start to see a different, a shift in the way the disease is progressing in the city, that they will reach out and we'll talk. I mean, they are in contact with our staff every day. Same with the health department. So, I mean, none of us has a magic formula about when do we worry and when, I think if you ask 50 people in town, including all of the people at the hospital and at the health department, you probably get 46 different answers on what should be the trigger. And I think that's the difficult part about all this thing, is that not even, we don't have a health authority of some kind that's saying exactly this is what should happen. They're saying, well, we're worried about people being in the hospital. Well, how many? Well, the guidelines say can we treat them without critical care, which would mean, we don't have to extend our normal ICU capacity. We don't have to, push other people out or delay care for other people because what's happening. We're not there. We haven't been there. And so, those are moving targets, right? And they change every day. And so that's the problem here, is that there's no magic answer that any one of them is going to give us that says, okay, if you see X, Y, and Z, then you do this. But the conversations are happening, and we're trying to get as much information as we can. We're having these conversations and we're keeping track.
Yeah, and I'll say too, the hospital has been pretty diligent about following these numbers. They do have an incident command, what they're calling an incident command team that meets daily over there and goes over the most recent data and the local numbers, not only for the city of Stillwater, but for SMC in and of itself, which is important to delineate because Stillwater Medical Center serves a population outside of the population of Stillwater. And so those two numbers can look very different as well. And trying to keep all of that separate, the incident command there has done a pretty good job of that. And again, that the problem comes down to I don't know that anybody knows the answer. I'm not sure that Dr. Fauci himself knows the answer of when do we as a municipality step in and make recommendations. Nobody knows that.
They're certainly not telling us, that's for sure.
Well, with that. And ramping things down at the federal level, there's also seems to be this idea that since New York and California seem to be on the other side of this thing, that it's all over. Certainly seems to be that way at the federal level. So that in and of itself is frustrating. But speaking to a little bit more local matters, I think that if you saw a day-to-day increase in our hospital of critically ill patients of doubling or more, that's where I would be exceedingly worried. Again, that's a number that I just kind of pulled out of thin air. But if you're seeing a day-to-day 100% increase or more, things get out of hand pretty fast at that point.
It's challenging though with this disease because there is such, right? I mean, we have people that are sick and then maybe don't get critically sick for, even a few days into their illness potentially, or, Or, we have young people that are impacted today, but those young people may have exposed not young people in the last week or 2 weeks during their illness. And so we may see those people come in critically ill in the next week or 2 weeks, or it is so very challenging.
Yeah. So, I think, we're flying a bit, we're having those conversations and we're trying to keep up with it on a day-to-day basis. We are keeping up with it on a day-to-day basis. It's just that the actual, trigger of when something should happen is a difficult one to pinpoint. I think, like I said, the health department has indicated that if they see a shift in how this disease is progressing in the city, they're going to let us know, right away, and we'll take, I think, action that we need to take. The hospital, if they see an increase in people coming in and needing inpatient treatment, they, will let us know right away, and we will, I think that will trigger action. I think that, if we have a few patients in the hospital with it, and they're, potentially problematic cases, that we have to start to shift back to some more definitive measures to try to keep it wrapped up.
Mayor, can we have some of those things kind of at the ready? Is that something that we can do now? I know you did mention that, we were looking at that. Is that something that we just need to have ready so that it's,
John's got Mr. Dorman has the declaration ready to go. If we need to move backwards, it's drafted up, was ready to sign it today. And, just kind of trying to work through this and try to figure out what all of the possibilities, what does it look like in a week? What does it look like in 2 weeks? And how long do we keep this in place? And what do we, there's so many moving targets at this point. It's difficult to know when we need to do that. But yes, it's ready. We will be ready to put it in place as quickly as we need to. I would also say that the existing order that we do have in place is good through the end of June. It does still strongly recommend shelter in place for vulnerable populations, for those folks that are age 65 and older who have complicating medical conditions. We're still very much encouraging those folks to avoid public interactions at all, if at all possible. Again, given that we are seeing more cases in public, it's even more imperative that folks who may have complications need to take all those precautions that they can take. But I think along those lines, we do need to step up our communications in conjunction with the hospital, the university, and the health department to get clear messages out there to the people who need to hear them. I was going to add, Amy, you were talking about reaching, specific populations. The health department did talk about getting out and doing evening what do they call it? Interactions, like in popular areas, like down on the Strip, and actually having people out there, doing education at those times, right, to get that word out.
Sure, that would be very popular on the Strip.
Well, they do that with other diseases that can be spread easily in that population.
Yeah, sure, right? We have probably a paradigm to follow with sexually transmitted diseases,
Yep.
Right? It's something, it's a kind of contact tracing that that contact tracers have done previously, yep. Right?
So, I think the other important thing, though, is to not, give people the impression in town that this is just a young adult problem and that, it's just them that need to be worrying about it, right? Because I have seen those comments and like, oh, this is just, bars and apartment pools, and I don't, if I'm not going to those places, I don't need to worry about it. That is absolutely the wrong message for us to be sending as well. And so we it is I think the message, if from all of this, if nothing else, excuse me, for the community, is if we want to be able to continue to open, have businesses open and be able to go in and visit restaurants and be able to go do the things we want to do and have all the activities that we want to have. If we want to be able to continue to do that stuff, we have got to do a better job of social distancing, wearing masks, and practicing the hygiene recommendations that are provided by the CDC, the State Department of Health, the Payne County Health Department, and every other medical authority in the world that is telling us, wear a mask when you're out in public, stay more than 6 feet away from people, avoid crowded areas, don't go into these spaces where you're creating high risk for yourself or for others. And if we can't do that, we are going to end up back in places we don't want to be, with restrictions on what we can do and where we can go and that sort of thing. I mean, it's inevitable, and I hate it as much as anybody else does, and I want to avoid it for as long as we can. But if we don't get our social distancing and our behavior under control, we're going to end up as a community back in those places. We're seeing it everywhere. We're seeing those growth. And just because some people don't want to admit that, or don't want to see it, and don't want to acknowledge it, it's happening, and we've got to do a better job of social distancing.
I mean, it just goes back to the idea of that, those freedoms to move about the way we want to move about, that comes with some personal responsibility right now. And I mean, I guess having a member in our family that is sensitive to these things, we had just kind of started feeling a little more safe and able to come out and start to kind of re-engage a little bit after a really isolating time, I know, for a lot of us. And the idea that, we'll have to kind of go back into some more deeper isolation again it's really hard. I know that everybody kind of has quarantine fatigue, and we're all tired and we want to see our friends. And I know we really want to see our friends too. I'd love to go into a store. I'd love to go into a store more often. It's just harder, I think, for our sensitive populations if we don't do the work, the little bit of work to help them out. I mean, it's a whole group of people that I just can't imagine the emotional and mental impact of this. And again, just back to that frustration of that personal responsibility and helping the people in our community enjoy some of the same freedoms that, the rest of the community is enjoying as we emerge from quarantine. So just do your part, guys. Do your part.
Pat, I think, excuse me, Vice Mayor, I'll follow up tomorrow with staff on like a formal sit down with those other entities to get some of this communication out. There were some joint press releases that were done at the end of last week. The hospital put out a kind of an ad, related to no one being immune from COVID, but I think we need to step up that in conjunction with a lot of other of these local entities and try to get that message amplified quite a bit more. So we'll follow up with that tomorrow. And we'll be, again, in constant.
I think that also increases the confidence of the community when they hear, yes, this is what we're talking about together.
Yeah.
We have just got to present a united front and all be saying the same thing. And we're not. We have never been. So let's start now.
Okay. I think that's a good goal. And we will, again, be constantly, monitoring those numbers and digging into the, what's underneath them to try to figure out when, if it's time to do something different. So we'll be we'll sort of let everybody know if that changes. Anything else related to COVID-19? Okay, we'll move to item 7, reports from officers and boards. Mr. Dorman.
Nothing, sir.
Mr. McNichol.
No item, sir.
Counselors?
I did have a note, a text that OnQ has 70 locations in in Oklahoma.
That's good to know. I will also just note here that we've asked, I've asked Mr. McNichol and Police Chief Watts for next week to come to our study session. We have a regular study session third Monday of the month, which would be next week, and we're going to spend that time next week speaking with Mr. McNichol and Chief Watts about police policy and about how Stillwater, what policies we have in place to prevent police brutality, to deal with use of force scenarios and all that sort of thing. We'll be discussing all of those policies in detail next week at our study session. So I'm excited about that and excited to appreciate Mr. McNichol and Chief Watts coming in to speak with us about that. So we'll be covering that topic next Monday, the 22nd.
Mhm.
All right. Is there a motion to adjourn?
Motion to adjourn.
Second.
We have a motion from Councilor Zanotti and a second from the Vice Mayor. Teresa, can you please call the roll?
Mayor Joyce,
Yes.
Vice Mayor Darlington,
Yes.
Councilor Zanotti,
Yes.
Councilor Wedlake,
Yes.
Councilor Jaloski.
Yes.
With a vote of 5-0, we are now adjourned from the Stillwater City Council meeting. At this time, I will call to order the Stillwater Utilities Authority meeting for June 15, 2020. On our consent docket tonight, we have special meeting minutes from June 1st. Is there a motion?
Motion to approve the consent docket.
Second.
Motion from Trustee Zanotti and a second from Trustee Wedlake. Teresa, please call the roll.
Chair Joyce,
Yes.
Vice Chair Darlington,
Yes.
Trustee Zanotti,
Yes.
Trustee Wedlake,
Yes.
Trustee Jaloski.
Yes.
With a vote of 5-0, the consent docket is approved. We'll jump down to item 5A under general orders, approve a budget amendment appropriating waste management revenue. Mr. Knight, good evening.
Good evening, Council Mayor. Chris Knight, Waste Management Director. We've had some circumstances out of our control this year that is going to cause us to exceed our budgeted amounts and several of our accounts. Two of the main accounts is our landfill disposal and fuel. And some of those reasons why we're going to exceed that amount is one, we've actually had a really good year. We've had some increased customer base on commercial and our roll-off business, which is we've taken more to the landfill and used more fuel doing so. And then the other reason is back in September, we kind of had a dispute with Cedar Creek Farms over some single stream material. To kind of work that out and keep them going, we agreed to haul off that single stream material, which it was a large amount, which increased our landfill cost for that and fuel also. We do have extra revenue funds that can be utilized to for the budget shortage. Is there any questions before my recommendation?
Trustees? What is your recommendation, Chris?
The recommendation is to approve the budget amendment allocating revenue funds to cover budget shortfalls in the Waste Management Department.
Thank you, Chris. Trustees?
Chris, I should have asked this question before you made your recommendation. So the budget, it's $61,105. Is that right? Am I reading that right?
I believe so. I don't have that in front of me. I'm sorry.
Okay. I was just looking at the budget amendment request.
We did also have a shortfall in one of our lease accounts. That was due to during this budget year, we're in a buyback program, if you remember, and that kind of changed over the fleet during this budget year, and we added 3 older trucks to that schedule, and it was a higher schedule, which caused that to have a shortage also.
Oh, maybe I'm not reading that right. So there's 3 sheets to this budget amendment.
Yeah.
Amendment and budget revisions, I think, in there also, where the money's going to be moved.
I was just thinking it was important to state what it was, but I can't really tell.
That's a good question.
So the net charge is the net charge the sum of all three of these numbers in boxes? So 84, I'm seeing 84,541, 79,436, and 61,105.
So is it total? Are those cumulative?
I apologize. I don't have that in front of me. I can't see those numbers.
Scott, well, they're different things. So the third sheet talks about landfill services, roll-off, fuel, vehicle repair parts. The second sheet talks about gain of asset, vehicle repair parts, landfill. Are they different?
Some of those,
Chris, I just was thinking we should just let people know how much we're moving.
some of those sheets are like the budget revisions. You show where the very first one should be the budget amendment, and then you have sheets there showing where the money's going to be, what accounts that are short.
Mayor, if I may
Yes.
interject myself, I pulled the budget amendments. They are amendments. And so on page 1, that has a total of 61,105. These are increases to the revenue accounts. So it's my understanding that these revenue accounts have brought in more than was originally budgeted. So you're raising revenue. And then on the page 2 and 3, you've got some additional totals here. They should be spreading that revenue increase over these expenditures, but those are not marrying
They don't
up. So I'm
add up
not.
was what I was.
Yeah. So it could be
So
that
Melissa,
there are. Go ahead, Chris. Go ahead.
Oh, sorry, Melissa. That was me, John Wedlake.
Oh, John.
So
Hi,
is
John.
is the first page is first page revenue and the second two pages expenses?
Yes, that's what I'm seeing. Oh, no, wait a minute.
Okay.
Yes. No. The first two pages are revenue. So you've got 61,105 and you've got revenue and some expenditures on the second page that ends in 79,436. So you've increased revenue, and then you're increasing those last two lines on that second page are increasing an expenditure. And then on page 3 that ends in 84,541, you're increasing expenditures.
Okay. So the first and third pages are pretty clear. Then the second page, this box total of 79,436.
It's a blending of revenue and expenditure. So 12, 14, 50. I mean, I think probably what we need to do is let us bring this back to you next week. We'll rework this budget revision so that it makes sense.
That sounds good. Good catch, Trustee Jaloski.
Sorry, I didn't mean to complicate things.
No, I mean,
trying to understand. It just seemed like we should say the number out loud just for a transparency, perspective to the community.
Right. Agreed. So we'll bring this back on the 22nd, next Monday. We will conduct some items of business before we jump into our topic, our study session topic, and we'll bring back this amendment for you.
Okay. Thank you, Melissa.
Great. Thank you.
Thanks, Chris.
Thank you.
That takes us to reports from officers and boards. Mr. Dorman?
Nothing, sir.
Mr. McNichol? Taking that as a no. Trustees, anything further? Is there a motion to adjourn?
Motion to adjourn.
Second.
A motion from Vice Chair Darlington and a second from Trustee Jaloski. Teresa, please call the roll.
Chair Joyce,
Yes.
Vice Chair Darlington,
Yes.
Trustee Zanotti,
Yes.
Trustee Wedlake,
Yes.
Trustee Jaloski.
Yes.
With a vote of 5-0, the Stillwater Utilities Authority is now adjourned. That concludes our meetings for the evening. Thank you all for being here.